My name is Jorn Van Der Veken. I'm a consultant neurosurgeon working in Adelaide. I work in both Flinders Medical Centre and the Royal Adelaide Hospital. They're the two academic units for neurosurgery in South Australia. And I'm also a PhD candidate through Macquarie University in Sydney. So an aneurysm is basically a weakened spot on one of the arteries anywhere in the body. So we can have aneurysms in basically every artery in every part of the body. But as a neurosurgeon, I'm particularly interested in the aneurysms that occur on the arteries and the vessels in the brain, so on the cerebral arteries. So it's a small focal outpouching or a ballooning on one of the arteries, a focal weakened spot. Yeah. And we see them very commonly. Yeah. The incidence of brain aneurysms is quite high. It's about 3 to 5% of the general population has a brain aneurysm, so a small ballooning or focal weakness on one of the arteries in the brain. And although most aneurysms never cause any problems and are discovered by chance when people get a scan for something else, a headache, after a trauma, sometimes these aneurysms can rupture, and when they rupture, they cause serious and often life-threatening brain bleeds. But again, luckily, we find most of these aneurysms by chance. Now, when you find those aneurysms by chance, what you try to do is you try to estimate what is the chance or the risk of this aneurysm to rupture over a patient's life. And you have to balance that against the risk of treatment, because treating an aneurysm also comes with its risks. And if you look at that equation, the safer your treatment, the lower the threshold to treat an aneurysm. And things have definitely improved over the last decades with less invasive techniques, and we now know that we can treat these aneurysms with a very low risk of mortality and a very low risk of causing major strokes or major complications. But an aspect that is truly understudied is the more subtle changes that often come to surface after treating certain aneurysms. Although people might look exactly the same from the bedside, when you scratch under the surface or when you have a deeper conversation or speaking to the partner, they do mention that something has changed, and can be a slight change in personality, can be a slight change in memory, difficulties concentrating, etc. And that's the focus of this PhD. It's firstly trying to map out how frequent does it actually occur. Are there any radiological or any blood sample indicators that might help diagnosis and that might help improve patient selection, that might improve outcomes. So that's the I'd say at the core of this project. So in this project, we're gonna firstly taking a step back. There's broadly speaking two different ways to treat aneurysms. So one is surgical, where you open up the skull and put a tiny metal clip at the base of the aneurysm. The other option is endovascular, where you go with a tiny wire, you navigate it all the way up to the aneurysm, and then exclude it from the inside out by putting tiny little coils or other devices within the aneurysm. And we don't really know which one is truly kinder to the brain. So in this project, we will follow patients before and after their treatments. both in the surgical group as well as the endovascular group. So an important part of this study will be to very deeply test these patients by neuropsychological assessments. So we want to measure how well they think and how well they remember. Then we will perform an MRI looking at the brain structure and connectivities with special MRI scans. And we're also going to analyze proteins in their blood, basically to look for biological signs of injury or stress to the brain. And then by combining these three perspectives, so cognition, imaging, and proteins, we're trying to build a more complete understanding of what really happens to the brain when we treat an aneurysm. I think the ultimate goal is simple. Like when we fix the aneurysm, we want to preserve more than the patient's life. I think it's incredibly important to also preserve the functioning of the brain. And I think if we can identify these early signs of change, we can probably improve how we operate or how we treat these aneurysms, inform patients better, particularly about the risks, the timing to recovery, and hopefully develop some strategies that protect the brain during these treatments. So furthermore, I think the research also broadens how we define a good outcome. I don't think it's just about survival or absence of huge strokes, but making sure that the person's cognitive and emotional well-being remains unchanged. So making sure that the patient who wakes up after the treatment is exactly the same person that went to sleep.